Georgetown Hospital is on the brink of crisis. Over 140 nurses have left their jobs in 2023. This mass exodus leaves the hospital facing a severe shortage of nurses, and current labor trends suggest that this will worsen in 2024. I'm the Unspecialist. Let's talk about why so many nurses are leaving Guyana and the nursing crisis at the Georgetown Public Hospital. Before we get into the main topic, here's a message from Washington law firm, today's sponsor.
One medical mistake can permanently change your life or the life of someone you love. These mistakes are too common in America, causing injury and sometimes death. If you suspect that you were injured as a result of a medical mistake, call Washington Law Firm today. Don't lose your opportunity to get compensated. Don't wait. Book your free consultation with Washington Law Firm by calling 718-877-3100.
Or find us at 455 Utica Avenue, Brooklyn, New York. If you'd like to advertise with us, be sure to make contact via our Facebook page. If you'd like to hire me specifically to host your events, for voiceovers, radio ads, or record other kinds of advertisement, you can also make contact using the same means. The beautiful voice that's in the ad on this video is available to you along with many others. Feel free to make contact and inquire about other services as well. Here's a breakdown of the current situation by the Chief Executive Officer of the Georgetown Hospital, Richard Rambaran.
We have a deficit about 55% in our nursing, direct nursing here. That's maybe about 600 nurses we need. And this is to take industry standard. Industry standard meaning an ICU, we need a one-to-one, one nurse to one patient in a step down, which is a high dependency unit, 2-to-1, and then there are other areas that you 1-to-4, 1-to-6.
To add some context with numbers to this deficit that he references, the hospital currently has 450 beds with 881 nurses on duty. To understand this crisis, we need to look at three things. What's happening in the health sector? What's causing this mass exodus of nurses? And what are some possible solutions to this problem? What's happening is simple. Nursing services is faced with an annual net deficit. This means that they're losing nurses faster than they can replace them, and that is affecting their ability to deliver quality care and services at the hospital. This issue is not only isolated to Georgetown Hospital. In fact, this situation can be used as an important case study or example for what's happening all across Guyana. Based on the CEO's comments highlighting that 55% deficit, the current staff is facing a serious workload, and management is facing an issue that, if left unresolved, could result in major failures if the system is placed under stress. Which brings me to the next question, and the main part of this video. Why are all these nurses leaving? Nursing, like many careers, is something that takes time and money to get into. For many, this is a serious investment of those resources. It is a career that is important, stressful, and difficult. So why, after making such an investment, would someone just up and leave? It's simple. The nurses are looking for better pay and better working conditions. Imagine making all that investment of time and money, graduating, entering the service, only for your career to be one that barely makes ends meet. Unfortunately, this is a reality for many, if not most, nurses in service today. As reported by nurses, nursing assistants make about $115,000 gross, or $550 monthly. Staff nurses get about $169,500, or $810 monthly. Staff nurse midwives get about $195,000 or $932 monthly. Taxes cut all those numbers down to size. For additional examples, out-of-region nursing assistants get about $156,000 or $745 monthly, which drops down to about $126,000 or $602 after tax. These numbers make it clear that low wages are a major push factor for nurses in Guyana. With the cost of living in Guyana, those salaries present nurses with some difficult decisions. We've seen nurses share how difficult it is for them to pay rent, bills, feed their families, or even think about saving for the future amidst their financial struggles in the present. This struggle drives the nurses overseas to the UK, Canada, and other Caribbean countries in search of better income. This starts a feedback loop where nurses leave. The remaining nurses have to work harder for the same pay that made the other nurses leave, which increases dissatisfaction, causing more nurses to leave or never start work in Guyana in the first place. This is a classic case of brain drain. Experienced people are lost from the system, and skilled nurses leave before ever entering the service. The promise, or even the mere possibility, of better pay and better working conditions overseas act as a very strong pull factor for these nurses. This essentially guarantees that this trend will continue into the future. So what exactly is the solution to this problem? The answer to solving the problem lies in the question itself. The solution lies in the very push and pull factors that cause this in the first place. At the heart of this issue is the need for Guyanese nurses to get better wages and better compensation for their skills in this economy. If the status quo persists, we will continue to see this mass exodus of nurses and this growing deficit. And the healthcare system in Guyana is going to look a lot more like a nightmare. No number of short-term solutions like importing nurses or otherwise can provide a permanent solution to this problem. Inevitably, in the long term, if wages and working conditions are not improved, the staffing in the nursing department is not going to improve either. And frankly, you don't have to take my word for it. Ask any nurse that's left the country or any nurse that's looking to leave their job or just completely dissatisfied. Even the nurses that are sucking it up and soldiering on, they'll share lots of stories about issues or difficulties that they've had to deal with, and how on more than one occasion they've been driven to or past the breaking point in their profession. Do you think nurses in Guyana are adequately compensated for their work? What do you think should be done to help these nurses in Guyana? Do you think these nurses are justified in leaving the country? And do you think there's hope for Guyana in improving or potentially resolving this nursing crisis? Let me know your thoughts down in the comments. Be sure to like the video and subscribe to the channel if you want to see more content in the future. As always, thanks for your support and thanks for watching.